If I had one bit of advice to give to college students thinking about going to medical school, it would be don't. First of all, getting your MD these days largely means you work for somebody else, and that somebody else isn't your patients. Doctors do not work for themselves anymore. It's very rare for that to happen. Employed physicians now have quotas. They have a certain number of patients that they have to see every hour. The amount of documentation that they have to get paid is exhausting. For my generation and older, this is not what we signed up for. The doctor merely exists to provide a diagnosis, and then an algorithm dictates a list of approved treatments for that diagnosis code that the insurance company pays for. So hear that again. Algorithms and protocols dictate treatment that you and I receive for a given diagnosis. The doctor doesn't make the decisions anymore. An algorithm does. This is really scary and should be really scary, because the less doctors think critically, the less we think critically when we're taking care of patients, the less we're able to think critically. So unless you go to medical school and become a surgeon, there's a very real chance that the need for those doctors is going to dramatically decrease